as we approach Mother's Day, I'm thinking about the Affordable Care Act in the context of women and what we did for women, particularly within the context of all Americans, and how many more women got health care as a result of the Affordable Care Act. I think about it, and I look at just what we did. 9.5 million women in our country previously uninsured, including hundreds of thousands right here in New Jersey, have access to high-quality, affordable health insurance as a result of the Affordable Care Act. In New Jersey, we know that women make up at least half of the 250,000 consumers who bought health care coverage on the marketplace insurance. And according to New Jersey policy perspective, over 500,000 of those who are now eligible and joined into Medicaid by Medicaid expansion as a result of the law, with an overwhelming part of those being women. And then finally, when we were in the midst of creating the law, we said women have certain unique health, opportunities and challenges. And so we created, and I must say that the women in the Senate, and this is why having diversity is so important in all of its iterations, the women in the Senate, when we were devising the package, said, there are a series of things that women need, from, many preventive screenings, questions of breast cancer screening, cervical cancer screening, the questions of prenatal care, and the questions, something that I've dealt with in the past from experiences here from some of the women leaders of our state, postpartum depression, which people used to call the baby blues, but actually has an issue with it. So on a whole host of things, we said there should be, within this essential coverage package, a reality that women, as the majority of the American population, need to have some special attention to. And we did that. As well as the benefit of pregnancy no longer being a pre-existing condition. And it just boggles my mind for the Republican Party that speaks about family values and the promotion of families, that somehow they would allow pregnancy to be a pre-existing condition once again. Because we can't have families unless there's actually some pregnancy along the way. So, at the end of the day, the consequence of what they now propose would, in essence, be a $17,000 more economic consequence to a woman, which I call a pregnancy tax. And that just boggles my mind as a value in our society. So those are just some of the keys that as we approach Mother's Day, and I often think about for mothers who are individuals who sacrifice a lot in order to nurture their families, the peace of mind that we gave mothers in our country, that their child, born with a birth defect, born with a heart murmur, born with a whole host of possibilities, would always have coverage now, because no longer could they be denied having a pre-existing condition. And that peace of mind is worth more than any money could be put together. So that's why I wanted to dramatize that while we think about the Affordable Care Act and we have big numbers out there, we're talking about real people's lives. And in this case, as we approach Mother's Day, we're talking about a real consequence to women in our country.
I got diagnosed again, stage 3, in September of 2015. Because of the ACA, I think conservatively over the 7 months that I was actively in treatment, we probably, if we didn't have this insurance, the bills that we saw were probably conservatively about $500,000 for one breast cancer patient over 7 months. And this doesn't include now all the scans that I need, all the doctor's visits I have to go to. One blood test, I would see the bill would be $650. What boggles my mind with what just happened with this vote last week, the $8 billion that suddenly made this act okay to the representatives that said it wasn't okay a month ago. $8 billion, when I did the math, I said conservatively, my one treatment is $500,000 for 7 months. And I have a friend who's a cancer scientist, believe it or not, and she said, Michelle, that's very conservative. And then I saw that it's $8 billion over 5 years. So it's something like 3,500 people in the whole country per year for 5 years get extra coverage. And that's what all of a sudden what makes the AHCA okay. And I'm shaking as I'm saying this. I can't believe that this has turned into a bipartisan issue instead of a human rights issue. I can't believe this is, as my hero Judge Judy says, I can't believe this is my America. And so, you know, we want to, and our 3-year-old daughter want to thank you for where you stand on this and how you've been fighting, and we want to help you fight in any and every way possible.
Your story exemplifies why the MacArthur Amendment is not enough. $8 billion is not enough. And we can do better under the Affordable Care Act. For the last 7 years, as a matter of fact, all Senate Democrats sent a letter to our Republican colleagues saying we stand ready to work with you to improve the law, but you got to get past the repeal stuff. Because we can improve it. Because there are still high costs. And how do we control the costs? How do we create risk corridors? How do we create greater competition in the marketplace? How do we create greater delivery systems? Those are all legitimate issues. But we can't create the high-risk pool that they suggest, as they suggested, and really say to people, honestly, we can cover them.
Right.
We can't tell the Michelles of the world, don't worry,
Right.
we'll cover you. That's just not true.
Right.
My one eye, I'm partially blind. If I had not had the opportunity to have home care and home health aid, I don't know where I would have been, because without the home health aid and the care they give me, help me, you know, have my breakfast made, my bed made, help me take a bath, you know, groom me, and then help me dress up and make sure I take my medication. You know, I am diabetic. I have hypertension. I have cholesterol. I use a cane, as you will see. I have to walk with this. And the home health aid takes me out to get fresh air, to make me feel, you know, that I am valuable and I need to live the best of my life. We need the program. Please, whatever will have to be done, let it be done, because it keeps us going. It makes us live. It makes us feel like, yes, we have a purpose in life. We are not just anything that is left unattended to. I'll keep saying it. Leave our medical home health care alone. Please support it. Continue with it, so that we all can have a good world to live in.
After my 6-year-old was born, I could not stop crying. I could not stop worrying. I could not stop thoughts from ruminating in my head. And I have always wanted to be a mother. It was the antithesis of how I thought I would feel after having a baby. And I was actually one of the lucky ones. After 3 weeks, my husband looked at me and said, I don't think this is the baby blues, as you mentioned. I think this is something more. You should really go call your OB, get a recommendation, go see a therapist. I think you really need to talk to someone. And I did. And through therapy, through medication, I got better. Anything that can help women feel okay about how their mental health is, anything that can help make pregnancy easier, reduce the shame and the stigma that is associated with having those feelings.
Last year, they told me they was going to take my uterus away. It was very hard, but I'm grateful that my doctor was on top of me, kept taking care of me, bringing me my medication, saying you have to come in for follow-ups. Well, this year, that was May last year. This year, I'm cancer-free. I'm grateful that it was hard, but it's something that just to have that person to talk to you and tell you, we here for you, it was very important, you know. And I really do appreciate it, and this insurance is something we women need it. You know, it's very hard. It's not easy. You know, a lot of people think, oh, we could give this amount of money or this amount of money, but they don't know what life they saving and what life they letting die, you know. Without this insurance, we're not going to be out there.
I want to know that I'm able to seek the treatment that I need for something that happened because of someone else's decision. It had nothing to do with anything I ever wanted to have happen. So the idea that someone who is a sexual assault survivor would possibly have to face having care inaccessible to them because of someone else's decision is reprehensible to me. And the idea that I wouldn't be able to seek mental health services, or if I did have other physical issues, if I wouldn't be able to seek service for those because it happened 13 years ago, that just, it doesn't compute in my brain.
Getting diagnosed with breast cancer at the age of 39, that was my first time that I went to have my examination. I was 12 years without any signs, and now I've been diagnosed again in my left breast with breast cancer. Currently, that's what I'm going through now at this time. And all of the appointments, I've had very good help with friends and family, very good support team. And when I hear of circumstances where my insurance is in jeopardy, I could not imagine being without health care. It would be devastating, and I'm like a fighter. I want to stay alive, and this is what's going to keep me alive.
I am a proud awarded U.S. Army veteran who served my country during 9/11 and throughout this devastating war, a time that doesn't seem to end. But depending on my PTSD and my MST, my mental health issues, I don't want my daughter to think that having angry spouts is normal.
I wasn't taught better than that. I want my daughter to be taught better than that. I have done everything to reach out to every organization that's out there to help me help myself. And one thing I really need you guys to understand is that when I went to apply for Medicaid, because I was a successful teacher and I used to make a lot of money before I got pregnant, they did not give me Medicaid. They did not give me welfare. They did not give me any of the help that I needed. I was homeless. It took 5 denials. It took me to be homeless in the street with a baby on my breast. Okay? It took that much for me to be able to finally get Medicaid. It is imperative that we do not lose these benefits.
Extraordinary stories for extraordinary times. Our fight to keep the Affordable Care Act and to improve it is going to depend upon real people. I'm going to work my heart out. I'm going to do everything I can, stop what they want to do, but it's going to be the collective stories we heard around this room today and others like them that are going to ultimately get people to hopefully come to their senses and to their better angels.